Welcome, everyone. I am Rachel Hughes, Community Manager at Alloy Women's Health. We are a telehealth platform bringing science-backed, evidence-based menopause hormonal solutions direct to your door. And today I am so pleased to welcome Dr. Vonda Wright to a conversation on all things, or at least many things, bone, muscle, joint, tendon, ligament health. An authority on active aging and sports medicine, a speaker and author of at least 5 books. Dr. Wright is a double-boarded orthopedic sports surgeon, entrepreneur, author, speaker, and innovative leader focused on optimizing personal and professional performance at every age. Dr. Wright's practice focuses on minimally invasive surgery for hip preservation, shoulder and knee reconstruction, cartilage restoration, orthobiologics, and the latest in injury prevention and performance optimization. In addition to her surgical practice, Dr. Wright hosts her own podcast, Hot for Your Health, which is relaunching with new episodes on February 6th and is releasing a free guide titled Strong and Courageous, initially for those who like to go it alone. And then also on February 6th, Dr. Wright will open up opportunities to work with her live through her program. Quickly, I just want to let our listeners know today that you can save $20 off any Alloy purchase using the code STRENGTH20, and also remind you to drop your questions for Dr. Wright into the Q&A. I will get to them as soon as I can. Welcome, Dr. Wright, again to the Alloy community. Let's get right into it and talk about the impact of estrogen and its decline over time. According to your work, your practice, your knowledge, where does this evidence of that decline show up in our bodies?
Yeah. So you know what? On Mondays and Thursdays are my clinic days. Today was an OR day. I just got done doing surgery, but on Mondays and Thursdays, people show up, and it is not uncommon when I see on my list that there's a midlife woman with a shoulder problem. Before I even go in, I know that there is a high likelihood that she has a frozen shoulder. And at this point, people have heard of that, meaning their shoulder will not move like this.
Yeah,
or
amazing.
I call it the I can't do my bra sign, right?
Right.
But I can't pin my own bra. But listen, what people don't realize, because we're really focused on the things we feel initially: hot flashes, brain fog, night sweats. I had all that. My husband and I tease each other that I got to throw out a thermometer to stay cool at night, right? That's what we're focused on. But what women do not realize and memorize these data, 80% of all women in midlife will experience the musculoskeletal syndrome of menopause, and 20% will be devastated by it. So that includes arthralgia, which just means my body hurts, my joint hurts, but there's nothing on X-ray, there's nothing on MRI. I just know that I feel inflamed and I hurt. And I had that. And I went from never feeling my body to barely being get out of bed. So arthralgia, if we don't pay attention, we will lose 20% of our bone density. We'll lose 20% of our lean muscle mass. I count fat in the musculoskeletal system. We will accumulate all this belly fat that we all talk about. And it's so common. And yet sometimes we don't know it's common. And we just think, and this is what women say to me. They say, oh my God, Dr. Wright, I am falling apart. I do not know what's happening. And then when I sit down on the chair in my office and I say, you are 48, you are perimenopausal, you are not falling apart. These are your hormones fluctuating. We begin to talk about it, they start to cry.
Yeah.
Because women, in trying to figure out what's going on, they think they're going crazy.
Yeah.
Because nothing's wrong on the X-ray. They're like, I didn't hurt myself. Why does my whole body hurt? Well, it's called the musculoskeletal syndrome of menopause. We're about to put a paper out about it. You are not alone. 80% of us have experienced this. But here's the deal, Rachel. You and I were talking about this before. The symptoms that I just named that are so troubling now and can be really really life disturbing in general are not permanent. But osteoporosis, frailty, loss of lean muscle mass, hurting all over such that we can't even do our daily jobs, let alone work out, are silent until your bones are silent until they fracture. Silent, totally preventable, but if we don't, can be devastating. So that's why I'm such a passionate rage to say, listen, we can be healthy, vital, active, joyful. We just have to understand what's happening. Know you're not falling apart. This is due to your estrogen walking out the door like a girlfriend that you pissed off and she's never coming back.
Right.
Friends aboard, right? Maybe we're gonna,
Yeah.
I'll show you my transdermal patch if you want it.
Yeah, I'd love to see your patch. I love to see a patch. Yes.
So
that's
anyway,
fantastic.
you
Yeah.
know, we can have a helpful message if we educate ourselves and fight for ourselves and have resources, right?
Just for clarification's sake, when
Yeah,
you refer to the musculoskeletal pain associated with menopause,
yeah,
many women, let's say, to use your example, a 48-year-old might walk into your office. She's still getting a period. She's
yeah,
perimenopausal. Will
yeah.
she fall into that category as well?
I'm so glad you said that, right? Because menopause is one day. Your listeners know that 366 days. I happen to know when mine was. Mine was on my 51st birthday because I was having my period on my 50th birthday.
Wow.
It's like a light
Yeah.
went off, right?
Yeah.
Yes, menopause is one day. Actually, these musculoskeletal syndrome of menopause start when you're perimenopausal and your estrogen progesterone balance starts. When your periods go wacky and you start getting brain fog, and that's when this shows up. If in your mid 40s or whenever, that's on average. Some women start
Yeah.
this midlife in 35, right?
Yeah. Yeah.
So whenever estrogen starts to fluctuate in your body and your ovaries are starting to retire, that's when this shows up.
Okay. And you mentioned frozen shoulder and the can I hook my bra or
Can
unhook
you
my
hook
bra?
your bra test?
But it's also showing up in
Oh,
muscles
oh,
and
yeah, I'll list them
joints.
again.
Yeah.
So we can
Yeah.
have total body aching for no
Mm.
reason. That's called arthralgia,
Okay.
right? That's
Okay.
due to inflammation. You can
Yeah.
have, the most common thing women talk about is frozen shoulder, right?
Mm-hmm.
But women over 50 have a much higher incidence of arthritis, which is why your grandmas get total knees and total hips and total shoulders, right? Replacements.
Right.
Much higher progression of arthritis after 50 when estrogen is gone than men do. Before 50, men have more arthritis. After 50, women have arthritis in their hips and their knees and their fingers. And that's why you see ladies' fingers are all like this, right?
Yes.
Due to arthritis. Well, that increases. So arthralgia, which is joint and body pain, increase in cartilage wear, which is arthritis, loss of lean muscle mass, right? We lose 20%. That's why
Yep.
if any of you've ever listened to me on Instagram, I talk all the time about lifting. I even show you me doing it.
Mm-hmm.
Loss of bone density, right? We will lose up to 20% of our bone density around the time that our estrogen is fluctuating. And why does that matter? It matters because more people die of hip fractures than any kind of cancer every year.
Yeah, let's dive into this a little bit. You made some points about this before we went live, which were so important, and we were kind of paralleling it to the work of urologists and vaginal estrogen, and you were
Yes.
talking about, go ahead, take it.
Yeah. So in the gynecourinary syndrome of menopause, the urologists and OB-GYNs want us to use vaginal estrogen, not only because it rejuvenates our vaginas and our vulva, but it helps to prevent bladder infections. Urosepsis or bladder infections that go to your whole body are one of the reasons old people die, right? So they are using estrogen to prevent death.
Right.
What I said to you is that People don't die of hot flashes, brain fog, night sweats. We die of hip fracture. You don't even know you have hips on the inside until you fracture
Right.
one, right? People die of hip fracture. We can prevent osteoporosis or treat it with estrogen at very low doses. It doesn't take high doses, but it takes it starting when you start perimenopause. You know, right now, one of the things I would love to get changed, and one of my colleagues in New York did get it changed with her hospital system. Insurance will only pay for DEXA scans, which is the
Right.
radiology tool we use to look at bone density when you're 65. Well, ladies, that's
Yes.
too late.
Yeah.
I've had 28-year-olds show up. I've had 50-year-olds. Every woman, perimenopausal woman coming to my office gets a DEXA scan because you can't know what your bones are doing unless you know what your bones are doing, right?
Right.
And
Right.
then you can take the steps. So my analogy or my correlation with gynecourinary syndrome of menopause to the musculoskeletal syndrome of menopause is that you can die from both, and estrogen can prevent those to some degree.
I love it. Thank you, Dr. Wright.
Well,
You just mentioned a DEXA scan. You laid it out. I just want to home in just for another second on that. They are recommended for women at 65. You're encouraging us to get it well before.
insurance will pay for it at 65. Okay.
Yeah.
Here's a point I want to make. Just because your insurance won't pay for something does not mean that it isn't important. Like insurance doesn't pay for a lot of women's health, right? It doesn't
Yeah.
mean it's not important. It's just that some executive has chosen not to pay for it. I encourage all women who have any risk factor for osteoporosis. You smoked, you were on steroids, your mother is shrinking. Did your mother be 5'4" and now she's 4'11"? Mine did, right? That's osteoporosis. Have you had a fracture? The greatest predictor of future fracture is past fracture, for instance. Are you tiny? Right? All of those, being female, all of those are risk factors for osteopenia, osteoporosis. I encourage all my women to get one. And if insurance won't pay for it, in some places, and in Orlando, I can find it for $99.
Wow.
So
Okay.
if you just don't get Starbucks for 10 days, you will be able to pay for your own DEXA
Yeah.
scan. And it
Yeah.
doesn't take prescription. Because you need to know, because I'm going to then say to you, we need to lift as heavy as possible. Well, I always say when I'm catch myself, lift as heavy as your bones will bear, right? So yes, DEXA scans all around, pass them out like gifts.
I want to get to the lifting in a second. I also want to let people know again, please do put your questions for Dr. Wright into the Q&A. I'm going to hit you, Dr. Wright, with a couple of just fast bullet point questions I want you to answer. I'm going to ask you some questions that came in to me, and then we're going to get to listener questions. You talked about osteoporosis. You talked about arthralgia. Sugar. I know this comes up for you a lot. No.
So how many of you want to be in pain and inflamed? How many of you want to be insulin insensitive so that you become diabetic? If that's you, stop listening.
Keep on with the sugar.
Keep
Okay.
on going. Listen, we are our adults. We have agency. If you do not want to be in pain, if you want to be more metabolically responsive so you're not laying on adipose tissue in inconvenient places, because listen, fat is not just inconvenient, it's a noxious metabolic organ. If those things matter to you, if not being in pain matters to you, if not being inflamed matters to you, if being metabolically as healthy as possible, then we have to stop with sugar and simple carbs. I am not anti-carb. I hope you don't send me, people don't send me hate mail. I am so pro fiber.
Yeah.
I am so pro making your bodies work to digest carbs, and I'll explain what I mean. But if you go to I just did a carb detox, I mean, a sugar detox for my people on Instagram, and I'll throw it up again. It's free. part of it is learning to read labels. If you turn over the label of any packaged food, you are going to read the words grams of added sugar. Why does yogurt need added sugar? Why do
Right.
my corn chips need added sugar? What is anything, right? It's sneaking into the amount of the average American eats 16 pounds of added sugar a month and don't even know it, right? So what do we want to do? Instead of eating quick cook oatmeal, if you want oatmeal, eat steel cut oatmeal because then your body has to work for it. If you want a potato, eat sweet potato with the skin on because it's full of fiber. Do you see what I'm exchanging here? Fiber
Yes.
takes energy to digest. That's why cows have 4 stomachs. It's hard to digest. You still get the
Yeah.
roughage that your microbiome needs and the carbs for energy. But a lot of times when women come to me with arthralgia, that pain, the inflammation all over, after talking about perimenopause and hormone therapy, I also say, okay, and I always stop like this. I stop. I want you to eat complex carbs and fiber, not simple sugar. And that includes alcohol. And
Yes.
you
Yes.
would think that I took their teddy bears away, and they are willing to do anything
Yeah.
until it comes to that. But
Yeah.
that shows you how addicted our brains are to sugar.
Yeah.
I was once the first time I did a sugar detox myself, I was addicted to sugar. I'd rather eat cookies for breakfast than anything. But I stopped. I don't even know why I decided to do this right before Thanksgiving when I was 48. And I had to go cold turkey because I can't just decrease it a little bit. I
Yeah.
can be on or off the wagon. Here, 2 things happened. Number one, within about 7 days, I didn't hurt anymore.
Mm-hmm.
I didn't feel
Interesting.
my body. Number two, I wasn't trying to lose weight. I rarely am. I like to build muscle, not lose weight. I lost 12 pounds.
Wow.
So it's because we eat 16 pounds of added sugar a month, right?
Yeah. Yeah.
Here's my long sugar answer. I'm just so anti-white sugar. And then people ask me, what about natural sugars? What about maple syrup or agave or name one? Well, listen, do you know where sugar comes from? Beets and sugar cane,
Hmm.
right? It's natural. Beets and sugar cane, it's a vegetable product. So it doesn't mean it's good for you.
Right. That's so helpful. And thank you for highlighting why it matters to our bones and that muscle achy, feel like you almost have a fever all the time kind of thing that goes along with perimenopause.
Yeah.
Calcium, vitamin D. Can you
Yeah,
hit on those for us?
I can. We all need vitamin D levels to be normal for a variety of body functions, not only bone, but our immune system, sometimes our brain. The evidence for that is very good. Usually D3, K2. K2 helps with absorption. Have your vitamin D checked, or don't, just start on vitamin D, but have your vitamin D checked. Most of us wear so much sunscreen and don't go out in the sun enough that we're low, right?
Mm,
So,
hmm.
when I supplement people, I my patients, I supplement them with sometimes 5,000 international units, which is about 125 milligrams, sometimes 10,000. The first time I tested my vitamin D and it was in the tank, I did 10,000, but we need normal levels.
Right.
The data on calcium is plus minus at best. So if you want to take it, take it. If you don't, I'm
Okay.
putting you on it. So, but vitamin D and K2 and magnesium for bones.
Okay.
Sometimes people throw out their boron. I'm going to honestly have to do more research about that. I can't quote you chapter and verse, but
Okay. No, I'm hearing a thread which is hormone replacement or menopause hormonal treatment, eliminating sugar. Those are 2 major things you can do to address what's hurting today and prevent trauma in the future.
yes,
Okay.
but that's not all.
Right. And I want to get to that. I absolutely want to get to that. I do want to ask you a few questions that came in to me.
Okay.
One, to begin, about frozen shoulder. I saw a photograph that you posted that was a picture, an internal picture of frozen shoulder, and it looked red and raw and irritated. And you talked about inflammation in that post. You talked about mobility, injections, hormone treatment to combat the inflammation.
Mm-hmm.
Can you speak about the mobility part? Because I feel like maybe that's the springboard into lifting and exercise and all of the other things that you would encourage us to be doing.
So mobility,
I'm not sure.
frozen shoulder, right? Yeah. So it is a natural response. If something hurts, to protect it, it's natural. I mean, it makes sense, right? Your shoulder hurts, you're not gonna like throw it around. You're gonna hold it in. With or without trauma, sometimes frozen shoulders start when you hit your shoulder against the door in the middle of the night, or nothing. You just wake up.
Right.
But it's a natural response to hold it against your body. Within 1 week, you will have a frozen shoulder because the shoulder synovium, which is the lining, is so sensitive to inflammation. Inflammation starts to make it contract. And so it doesn't take very long, hoping that it's going to get better, protecting it like this until you can't move it. So how I treat frozen shoulder is A, education. I tell women why it is. B, we discuss them making the choice whether or not they're going to go on hormone therapy. I then usually have to sit there and dispel a bunch of WHI myths.
Yeah,
I always refer them to the book Estrogen Matters. And then they want to know where to get it. Of course, you guys have it, right?
We love that book. Yes.
Their doctors either won't or don't know how or whatever. I mean, and then for the actual treatment, if it's not too painful, I send them right to physical therapy because stiffness is painful. If they're incredibly painful and can't tolerate motion, just a steroid injection in there. I don't love steroids, but to decrease inflammation, that's one way we can get a jump start on therapy. And then they do therapy. And usually they start to get more mobile. They'll feel better. This takes time, people. When I finally, another thing I do, because it has a very profound anti-inflammatory capability, is use something called platelet-enriched plasma, where we draw 60 cc's of blood out of the antecubital vein, this vein in your arm right here, spin it in a spectral centrifuge where we can harvest 5 billion platelets and inject it in the area because the growth factors that the platelets release are anti-inflammatory.
Okay.
If nothing works, then that's what you see when I post it. I take someone to the OR and put them to sleep and then very gently move their arm for them. And I will hear I don't know if you hear pop, pop, pop with the skull bands breaking up. And that just gives them a jump start on mobility. And then we do therapy 5 days in a row. In the woman that I posted, it was so bad I couldn't get her motion just with gentle motion. So I went arthroscopically and broke the bands up so that she could move. So
amazing.
It does. It comes from very mild to just 2 years later, you can't move.
Yeah. Okay. Moving on to a question that came in to me about frozen shoulder. And for everyone who's put a question in the Q&A, I'm about to get started with you, so just hang in there. The connection between thyroid disease and frozen shoulder. A community member has shared that it's her understanding that Hashimoto's goes hand in hand with frozen shoulder, that she has Hashimoto's, had shoulder surgery in her mid-40s, and her surgeons and physical therapists were very concerned that she begin PT the day after surgery so as to avoid frozen shoulder. I actually feel like you kind of touched on that a little bit.
I did. So Hashimoto's thyroiditis is an inflammatory problem, right? So frozen shoulder is not unique to only midlife, perimenopause, menopause. It happens with diabetes. It happens when estrogen walks out the door. It happens when you have an autoimmune inflammation. So it's an inflammatory process. So yes, you can get frozen shoulder with any of those inflammatory processes. The one out of nowhere with healthy women, is what we're talking about. Like, they're like, I don't know what I did. My shoulders won't move.
Okay, great. Thank you. Someone asked about frozen hip, and she said, is this a thing? You know, like, I feel she's sort of saying, I think I have this. Is that a real thing?
Well, not as much as frozen shoulder, but what women do get in their hips is bursitis, which is pain on the side of their hip. If we define hip is your groin. If you want to know your hip
Right.
is, it's your groin. If you have pain in your groin, that's probably your hip. If you have pain out on the side of your leg and down the side of your leg, that is bursitis. And you know where that comes from, my friends? That comes from having a weak butt and core and walking like a supermodel. Now, I love me some Coca Roca, and she can walk the catwalk, but that's not how she walks in normal life, because I've seen her. That's
Okay.
We are not designed to walk with our hips doing like this.
Yeah.
And when we do, it puts undue stress on our hips because our bodies don't want to be like this. They want to be like this. So we get bursitis when we're inflamed and when our butt, core, and hips are weak. So frozen hip, not so much, but maybe stiffness because it's hurting and you're not moving it. Does that make sense?
It does make sense. And I want to begin asking questions that have come in, but you just made me think about, other than heavy lifting, like, our bodies want to be doing what? What should we be doing in and out of the gym to kind of keep ourselves, I don't know, limber, lubricated, strong, balanced?
So if we think about the way our bodies are designed, and I encourage when I write, I encourage people to actually stand in the mirror and look, because we don't notice ourselves. When's the last time you actually noticed yourself other than to criticize your belly fat? Please don't do that. One of the things that comes with age and experience, right? So anyway, if you notice yourself, where are your biggest muscle groups? Not in your arms, people. Never will be. Even if
Mine is my butt.
It is belly button down. It is your butt. It is your lower core. It is all the giant quads and hamstrings. So if we think that form follows function, like, what if we were built by an architect, right? Form follows function. If all the biggest muscles are in our legs, what does that mean we're designed to do? We are designed to move.
Right.
So I encourage everybody to lift heavy, and lift as heavy as your bones will let you. But the thing that research has shown is that fidgeting and walking around and standing up and down every hour and getting microbursts of mobility in is actually what we're designed to do. Because what happens when we sit all day? Well, our bodies think that we are maybe in the middle of winter, sitting in a cave with no food in sight. We're just going to sit here and conserve, right? But if we're moving around, it means that something healthy must be going on, and our bodies respond to that. So I want you to fidget all day, get up and down, get a standing desk, sit down. I want you to take your phone calls or your conference calls doing wall squats. Nobody knows what you're doing. In fact, I feel so compelled. I feel like I need to stand up right now.
You can stand up. You can preach to us.
Yeah. Yeah. So just constant mobility, because here's what we know. And I said this to you when we were off air. I'm an orthopedic surgeon, or maybe it was on air. And people think that all I want to do is the mechanics of putting metal in bones. No.
Right.
I get up every day and help people because I know that by restoring your mobility, I am going to save you from the ravages of chronic disease.
Yes.
That is worth working for.
Very exciting. I love that. Okay. This question, how can we fix joint stiffness? Exactly to your point. I have such awful pain after sitting for long periods of time, and I have a desk job.
Yeah. So there are some parts of our desk job that we must be sitting because they take high brain focus, blah, blah, blah. But I bet there's a lot of the day that it wouldn't matter if you were standing or sitting. So for people with desk jobs, there's no way to overcome 10 hours of sitting in this kind of slump position. No way. So I'm going to encourage all of you to set whatever alarm you have, stand up, stand down, go to the carpet or come back, go up and down the stairs for 2 minutes every hour, and just keep moving all day long.
I love that reminder to set an alarm to do it too, because we think we'll remember, we get distracted, we're in the middle of stuff, and before you know it, hours have gone by. Okay, best bone building exercises for hip osteopenia.
Three things. Rebounding is what NASA uses to help astronauts rebuild bone and muscle when they come from space. So if your knees hurt too much to get out and do number two, I'm about to tell you, rebounding works on a mini tramp. Walking in water, because you're buoyant, you're still moving, you're still getting some impact, but it can be less painful. Number three, jumping up and down 20 times. Now, I'm not asking you to do plyo, jumping off of 6-inch boxes if you have osteopenia, but I am asking you to stand at your sink in the morning and give a little hop.
Right.
20 times. And then finally, I want you to lift as heavy as your bones will let you, because there's a direct connection. It's the bone muscle connection. Strong muscles help strong bones, help make strong bones, right? They're connected organs. And so those are the four things, actually.
This is a stupid question, but is jumping on a rebounder the same sort of in terms of what it does for your bones as hopping up and down on a flat surface?
Well, if I get to choose, you're hopping up and down on a flat surface.
Huh. Okay.
But there are some people who have a lot of pain and cannot. And so rebounding has been shown to work. In fact, the first time I had to look it up because I was so skeptical. And then lo and behold, NASA uses it. So it's good enough for NASA.
Interesting. Okay. Someone says that estrogen is not available to her. She's 78 years old. I'm not sure exactly what her question is getting at, but
well, maybe what can she do to feel better?
yes, and actually to that, someone did ask me on my feed about women in their 70s and 80s, and she didn't ask anything specific. She just said, anything for us older women. And what would you suggest or comment about for women who are further into their postmenopausal years?
Here's what I'm going to say to you. There is never an age or a skill level when your body will not respond to the good stress that you put on it. Estrogen is one item in my list. It is not the whole list. So you can still get rid of simple carbs. You can still learn to lift. And if you want inspiration, I'm going to turn you on to one of my girlfriends.
I bet I know who you're going to say.
Yeah, well, there's two actually. There's many actually, but there's women on Instagram led by a bodybuilder named Michelle. Her mother is Train with Joan, who started in her 70s, but also Susan Geedy, who goes under Kiki Mouse Gets Fit. They all started in late 60s, and they didn't have estrogen, but they have done everything we've talked about today. They are mobile. They lift as heavy as their bones will let them. They have a very macro-based, high-protein diet. We didn't even talk about high-protein. High-protein, macro-based, anti-inflammatory diet. You should see these ripped women. They are so strong. And I'm not trying to be a bodybuilder when I lift, but you know what I'm trying to do? I am trying not to be so frail that I fall down in my own kitchen and break my hip.
And break a hip. And shorten your life.
Yep.
Thank you for that. Shoulder bursitis and frozen shoulder, is that the same thing? If so, how long does it last and what can be done to relieve pain? So you spoke a lot about what can be done to relieve pain, but if you want to focus on bursitis and
you know what, bursitis is thrown around interchangeably. Bursitis doesn't necessarily lack motion, but both are inflammatory. You can have bursitis and still be able to move your arm.
Okay.
It confers inflammation of the inside tissue of the shoulder.
Okay, great. This is an interesting question. What strength estrogen patch is high enough to reduce these symptoms? I'm really glad this person asked this because
Yeah.
I think it's nuanced and who you speak to matters about it. But what would you say for somebody who, let's say, has a patch already, or taking oral estrogen, or using a spray, and is still feeling arthralgia?
Very low dose estrogen will lessen the musculoskeletal syndrome of menopause. There's actually a paper that I reported on Instagram. It's 0.025, which is the very low dose. I personally take 0.0375, and estrogen is dosed according to symptoms. So if you're on it and you still feel a way that you don't like, talk to your clinician and they may be able to increase it, right? But remember, estrogen is not the only answer. If you are on estrogen and you expect that everything's going to feel great, but you still eat 16 pounds of sugar every month, I think that there's more work to do.
Great point. Thank you for that. This is a good question too, because it's so popular. Does collagen powder work to help joint stiffness? And if so, is there a kind you recommend? Collagen powder is very popular. What say you about it?
So how many papers do you want to read? Because let's say you read 100 papers, 50 are going to say it works and 50 are going to say it doesn't work, right? And so,
okay.
There's good data. There's data on both sides. So here's how I counsel my patients and how I do it myself. The data is mixed. It is probably not going to hurt you. So that if you want to take collagen peptides to encourage collagen synthesis, just find one that suits you. I happen to take a fish peptide collagen. I'm happy to name the brand if you want. Is that okay? Yeah, I use Remon.
Let's do it.
Yeah, Remon, Riman. I take fish collagen. Do I know that it's working? I don't know. I've had this mess of hair my whole life. I can't tell.
I was going to say, is hair the evidence? Because
yeah, look how well it works. I don't know. But you know what? It's probably not going to hurt you. So I'm so sorry to say that there isn't just level 1 studies that say it's good or bad. Probably not going to hurt you. If you think it works, just find a good brand that suits
Thank you for that. Very honest response. This person commented, new mantra, I'll show you my transdermal patch if you show me yours. I'm all about it. I love it.
Yeah.
Okay. Sudden swollen finger joints out of nowhere, she writes.
Yeah, hand arthritis is one of those that come on rapidly after menopause. So knees, fingers, and to a lesser extent, hips. So common. Usually down here on the distal joints. So unless you think you've got high blood pressure, all of your hands are swollen and your ankles are swollen and maybe your cardiac function. I mean, I don't want to just blow it off as if everything's swollen, but specific joint swelling can be arthritis. It's common.
And anything to do about it?
All of the things we talked about, right?
Perfect. Thank you. Okay. I was diagnosed with impingement syndrome in my shoulder and went for PT for 8 weeks and it left. Shoot, the question left. And 8 weeks and a cortisone shot. Saw some improvement, but still have pain out to side and cannot do the unhook your bra test. Going for an MRI as soon as I can get in. I'm 54, have not had a period for 2 years. Is it too late for me to start HRT?
No, right?
No,
The data shows within 10 years of your menopause, and if you're more than 10 years, let's not get hung up on that because I get lots of questions. What about me, 70? Listen, as long as you have a risk assessment with your clinician, there are many women who either are starting later in life or who never came off. They ignored the WHI, never came off. So as long as you have the conversation evaluating your personal risk factors with your clinician, right?
Yeah, thank you for that. That actually answers a question that I won't highlight, but yes, please speak to your clinician. And again, I do encourage you to jump on to the Alloy website and connect with a menopause specialist who can really deep dive into these questions for you, with you, excuse me. I'm 53, have osteopenia, diagnosed at 51 with a DEXA scan. I am estrogen and progesterone positive breast cancer that same year.
Okay.
After surgery and radiation, I went into menopause after starting tamoxifen. I have all of the muscular-skeletal syndrome and almost all menopausal issues you mentioned, and it's very hard for me to exercise because of that. Who can I get help from, and what should I do? I feel stuck and desperate as my quality of life rapidly declined.
Well, I think that's a really tough situation, and there are many women in that situation having to make the decision about what to do about hormone therapy when they've had a breast cancer history. So I have several things to say. I know that it hurts to keep moving, and that's when you do something like find a warm pool at the YMCA or in your neighborhood if you live in Florida, right? Find a way to be mobile, even if it's walking around a hot tub in some place you have access to, a YMCA, your gym, right? Stay mobile. Do what you can. No one's requiring an hour and a half of hard work, but mobility will beget mobility. So that's number one. Number two, and this is not a plug. I mean, I'm just honestly telling you, person, Dr. Corinne Men on Instagram, who is an alloy physician, who
Yay!
herself had breast cancer, is my go-to reference for this question because I do not pretend to know all of the breast oncology literature as an orthopod. I have educated myself about menopause. I can advise about uncomplicated menopause as per the Menopause Society guidelines. But when it comes to hormone receptor positivity, negativity, literally, Rachel, every question at Dr. Men OB.
Yeah.
He's one of your clinicians. So
Yeah.
you need to find someone who is very versed in that literature to help you.
I so appreciate that answer. And I'm laughing because Dr. Men is swamped all the time. And
Listen, I
she
tried to
will
get a
be more,
patient
but
in to
she's,
see her.
I know, I
I
know
couldn't
it's
do it.
near impossible, but I think she speaks so well to all of this, but certainly speaks to the fact that it's critically important to speak to somebody who really knows the science around cancer and hormone treatment. There is no reason to be sort of living your life in fear and without relief anymore. When you say lift heavy, I'm assuming it's primarily to help with lower body since it's the biggest muscle group. So would it be squats with heavy weights, and would stair stepping also help?
So heavy lifting, I define it as, and besides myself, a great reference for this is Dr. Stacy Sims, a physiologist. But
Yeah.
lifting heavy there are four primary motions, and this is what Strong and Courageous, the do-it-yourself guide, is going to walk you through. And then if you join me in my course, my life course, it is not just lower extremity. I cannot tell you how many women I bring to the OR and say, okay, now move from the transport gurney to the OR bed. They can't lift their upper body with their arms. They can't scoot over. That is dangerous. It is dangerous for you not to have any upper body strength. So lifting heavy is upper and lower body. It is four primary motions. There's a push like a bench press, a pull like a pull-up, a squat, and a deadlift. Doesn't have to be powerlifting, but those motions, and then the motions that support those. So for the upper extremity, biceps, triceps, lats, delts. Similarly for the legs. But what heavy means is for the four primary lifts, you need to lift as heavy as your bones will allow you, but that means only what you can lift about 4 times.
Okay, that's so helpful.
Picking up a mamby-pamby pink weight and doing 36 reps, stop wasting your time. We are trying to create enough stimulus to make your muscles produce more muscle, to cause replication of your muscle stem cells called satellite cells. That comes with, and to make more muscle bunches fire at once, that comes with stimulus. Pink weights will not do that for you. So as heavy as your bones will allow you, 4 reps, this is the simplified version, 4 reps, 4 sets. For the other muscles that support the push-pull, you can do 8 reps, but only 3 to 4 sets. So my example is this. I can biceps curl 15 pounds until tomorrow morning, but I can only biceps curl 25 pounds 3 times. That with good form, and that's what will stimulate.
That's what you're aiming for. That's so helpful. Thank you for that. Guys, Dr. Wright has to leave us in about 4 minutes. She is working and has a patient. Yes, but I did want to get to one more question too, if we can.
I'll be short
There
with
was one. Yeah. Okay. Fibromyalgia after menopause. Any restrictions? I have lumbar facet issues and a bulging disc in the neck. I'm 55. I'm on HRT. Any advice?
Well, those are 2 separate things. Fibromyalgia, not bulging discs. They're 2 separate things. In fact, Mary Claire and I were talking about the fact that I said to her, oh my God, do you think that arthralgia of perimenopause is actually what they're calling fibromyalgia? Because it's the same demographic of women. And do you know she went back in the literature and found it? That we've been just labeling women with fibromyalgia because you can be diagnosed with a biopsy, or you can just have a diagnosis of exclusion. Like, I don't know what's wrong with you. You must have fibromyalgia. The literature says that fibromyalgia can simply be arthralgia. So that's number 1. For back problems, it's hard when you already have those discs, but I'm going to tell you, strengthen your butt, core, and hips by building some lean muscle mass. And I never talk about weight. I don't. I want you to exchange your fat volume for muscle volume. You'll probably weigh more, but fat does nothing but hang around and be noxious. Muscle will support those pains.
Terrific. Thank you. Last question. I'm 63 years old with knee arthritis and achy hips. Are Pilates classes using reformer machine and floor good for building muscle and bone strength? Pilates is so popular. This is
it is so popular.
Yeah.
I never tell people to stop doing Pilates because all those wires, you're building muscles you didn't even know you had. It will build core strength. It's not gonna build muscle mass in the way that lifting weights would. So I'm never gonna tell you to stop doing Pilates because it's better than sitting on the couch and waiting to feel better.
Great. Thank you. Thank you, Dr. Wright. I do want to encourage everyone to sign up for Dr. Wright's newsletter. Follow her on Instagram, Dr. Vonda Wright.
Yes.
Dr.
Vonda
Wright. That's what I'm going for. Thank you. Yeah. For all that you need to know, and to get the best information, get more information. Anything you want us to know finally?
Here's what I want you to know. Listen, I know this can be really hard. I know it's hard. I've been through it. It's hard. But here's the deal. In 2 things, until you decide that you are worth the daily investment in your health, then nothing else matters. And you are worth the daily investment in your health. And even if it's a tiny, tiny little step, you are worth it. And so that I hope that you will take it and seek out the help from people like me and Rachel to build community and to know that you're not alone, because I frankly think that midlife can be the most amazing time of life if we pivot our mindsets and look to the future and not look backwards and remember a youth that probably wasn't as good as we remember it anyway. So yes, the best of life.
So true. I wouldn't go back for anything. Dr. Vonda Wright, thank you so very much. You're just lovely and knowledgeable, and I hope we get to speak again. There's so much more to get into. Thank you for carving out this time in your busy schedule for all of us. And finally, to any of you who have questions about the hormone piece of your treatment, I do want to encourage you to head over to the Alloy website and enjoy 20% off $20 off any purchase today using the code STRENGTH20. Thank you, Dr. Vonda Wright. Everybody get moving. Go lift heavy as your bones
will let you.
Will let you. Woo-hoo. Thank you. Bye, everyone. Thanks, Dr. Wright.
Bye now.